on Planetterrian Daily, episode 66, coming to you on May 22nd, 2026. Let's get into today's research and health developments. A new review details how sleep physiology influences dementia risk through glymphatic clearance and vascular dynamics. A new review examines connections between sleep processes and dementia development. It covers glymphatic flow, blood volume shifts, heart rate variability, and neuromodulator activity. Planetterrian outlines how disrupted sleep may impair waste clearance in the brain. The analysis integrates multiple physiological systems rather than focusing on single factors. Follow-up work will test targeted sleep interventions in at-risk groups. From the active nighttime processes in the brain, we turn to even older biological systems that still shape our defenses today. Now, here's something most people get wrong about sleep. Most people assume the brain rests completely during sleep with little active maintenance occurring. In reality, sleep triggers a specialized clearance system that removes metabolic byproducts accumulated during waking hours. Right now, as you rest tonight, your brain's glymphatic pathways expand to allow cerebrospinal fluid to flush through tissue more efficiently. One memorable detail is that this flow can increase by up to tenfold compared with wakefulness, moving proteins and other debris toward drainage routes. The process also involves coordinated drops in heart rate variability and shifts in blood volume that support fluid exchange. Without adequate time in deeper sleep stages, these clearance mechanisms slow and waste products build up. A practical step is to protect consistent sleep timing, since even modest schedule disruptions can measurably reduce overnight clearance efficiency. Watch for upcoming studies that link specific sleep metrics directly to long-term cognitive outcomes. While evolutionary history explains broad immune patterns, researchers are also developing practical markers for specific diseases. Researchers traced key immune system components to ancient battles between microbes. The work maps molecular defenses that emerged from those early conflicts. Visual reconstructions show how these systems integrated into modern immunity. The findings clarify evolutionary steps that produce current innate responses. Further studies will test how these origins affect contemporary immune disorders. Diagnostic markers like these often emerge from basic physiological measurements, including new reference data in younger populations. Specific oxidative compounds appear elevated in red blood cells of people with Alzheimer's. These markers differ from patterns seen in other dementias. The discovery supports development of a simple blood-based test for early detection. Researchers note the approach could distinguish Alzheimer's from related conditions. Larger cohort studies are underway to confirm diagnostic accuracy. The identification of elevated oxidative waste products in red blood cells offers a potential route to earlier Alzheimer's detection through routine blood draws. This approach could distinguish Alzheimer's from other dementias without brain imaging. It builds on existing knowledge of oxidative stress in neurodegeneration by focusing on accessible peripheral markers. Doctors might one day order this test during standard checkups for older adults. Practical barriers include the need for larger validation cohorts and standardized lab protocols before routine use. Insurance coverage and integration into electronic health records would also need resolution for widespread adoption. Similar measurement approaches are now being applied to fertility monitoring after cancer treatment. Researchers measured deep fascia thickness in healthy children's legs using ultrasound. These reference values provide the initial standard for comparison in clinical settings. The data support non-invasive diagnoses of musculoskeletal conditions. Doctors can now identify deviations earlier without invasive procedures. Validation across larger age groups is planned next. Aggressive BEP chemotherapy for testicular cancer damages sperm production. Scientists identified H4K12AC as a reliable indicator of overall sperm health. Higher levels of this marker correlate with better recovery potential after treatment. The finding offers a practical way to monitor fertility restoration. Longitudinal tracking in patients will refine its clinical use. Students using ChatGPT for grammar showed greater gains when a teacher provided oversight. Independent AI-only study produced inconsistent results across participants. The study tracked performance metrics in a controlled classroom setting. Structured human input helped learners apply corrections more effectively. Expanded trials will examine other language skills. Researchers measured reduced GLP-1 concentrations inside joints of arthritis patients. The findings suggest direct anti-inflammatory effects from GLP-1 drugs beyond weight loss. High-dose medications could reach joint tissues and modulate local inflammation. This mechanism opens a potential new treatment route for arthritis. Clinical studies will test joint-specific outcomes in patients. Fewer than 1 in 3 trial protocols connect to documented patient data and outcomes. The report shows flawed decision patterns risk being repeated at larger scale through AI tools. Researchers examined protocol structures across multiple therapeutic areas. Better integration of real-world data is recommended to improve future trials. Regulatory bodies are reviewing the implications. A San Diego biotech was selected to supply an investigational antibody amid a worsening Ebola outbreak in Central Africa. The therapy targets the virus directly during active transmission. Deployment focuses on treatment rather than prevention at this stage. Health officials continue monitoring case numbers and strain characteristics. Additional supply agreements may follow depending on epidemic trajectory. Combining a TROP2 antibody drug conjugate with Keytruda reduced progression or death risk by 65% versus Keytruda alone. The data come from treatment-naive patients with PD-L1 positive non-small cell lung cancer. The abstract was released ahead of the 2026 ASCO meeting. Tolerability and overall survival data remain under evaluation. Phase 3 confirmation is expected later this year. Next time, we'll be watching for results from the expanded trials on fascia thickness across age groups. That's Planetterrian Daily for today. If you enjoyed this, a rating or review on Apple Podcasts or Spotify really helps new listeners find the show. I'm Patrick in Vancouver. Thanks for listening, and I'll see you tomorrow. This episode used AI voice synthesis of my voice. Editorial selection and analysis are my own.